capital Khartoum are slowly becoming empty after a recent decision to shut the facility down. As the largest teaching hospital in the country, it serves an average of 700 patients daily, most of them from the city's poorer suburbs who cannot afford the private clinics that have mushroomed in Khartoum the past few years. Well, a group of Sudanese doctors is concerned by the hospital's closure. Dr. Issam Osman is a London-based Sudanese consultant surgeon who goes out to the hospital often to help care for patients.
Well, we received reports on the night of Thursday, the 31st of December. They began the closure in stages. There's currently, I understand, still 4 surgical units with patients still on them, but of the 1,000 beds in the hospital, I think they're down to 300, and the other 300 are being closed in stages. People go home for the evening and they come back and find that wards have been emptied and patients have been discharged or released.
Was there any prior notice or any consultation with yourselves as doctors or with the public about this?
No, this is what's caused us a great deal of concern. I mean, our group in the UK and the groups and professional bodies in the Sudan have had no prior warning of this, and there's been no consultation period. Our concern really is that we don't feel that there are appropriate plans made for the care and welfare of these patients who are being discharged. We're getting reports that many of them are being transferred to other hospitals, private and government, but Khartoum Teaching Hospital is the largest teaching hospital in the Sudan, and it's multi-speciality. These other facilities, including the private sector, are not able to deal with this influx of patients.
And what kind of cases typically would they look at that the private establishments cannot, take care of?
Well, this is a center for neurosurgery, cardiac surgery, thoracic surgery, cancer surgery. So, these are specialist tertiary services that I'm not aware that any private hospital in the Sudan has got the facilities to take, notwithstanding the fact that over 95% of the Sudanese can't afford private healthcare. So there are stories of patients having to sell belongings and things to be able to pay for beds in private hospitals where they can find them.
So why do you think this has happened then? Do you suspect some ulterior motive behind this?
Well, it's difficult to make any conclusions. We do note, however, that the footprint of the hospital is in downtown Khartoum. It's a very large plot and therefore has significant real estate value. And there are reports that there are plans to sell it off to a private investor, although we've not been able to corroborate these. Or it may be part of a modernization agenda that the ministry wants to implement, but there's no clear strategy and there's been no consultation. And more importantly, there's been no dialogue with the senior medical establishments and bodies in the Sudan.
And the fact that it is a teaching hospital, typically it also serves as a training ground for medical students. So
absolutely, the Khartoum Teaching Hospital was one of 2 major training hospitals. It's not clear where these young students will be trained, nor the residents and the trainees. The Minister for Health, who is a major shareholder in a private medical school and many private hospitals, needs to answer these questions and what his plans are for the continuation of surgical, medical and other speciality training.
That's the Sudanese consultant surgeon, Dr. Issam Osman then. We're still chasing a response from Sudan's Health Ministry, and we'll bring it to you when we have it.